Hi, I'm Alec Shackleford and I'm a Radiation Protection Technologist for the Sheffield Teaching Hospitals Trust. Well, at secondary school I was definitely more interested in playing football, and I ended up with mainly C's at GCSE, so pretty average, but it was just enough to scrape into sixth form, and that's where I studied maths, chemistry and physics. And it was during sixth form where I thought about going into career in medicine, because I really like the idea of being able to help people. But my grades, they just weren't good enough to go straight into medical school. So I ended up doing a degree in physics at Nottingham Trent University, and the idea was to apply to medical school for a fast track course. But for a number of reasons that didn't happen, and I ended up going on to do a PhD at the University of Sheffield because I really liked research, and that was based in radiation detection. I've had a load of different jobs before this one. I've been a pot washer, bartender, I've worked in a cafe, a chip shop, a theatre usher, a labourer, a graduate teaching assistant. I worked in student halls. But I think it was whilst working as a postdoc researcher where I started thinking again that I wanted to have a career where you can help people. And that's when I started looking at jobs on the NHS website and came across this one. I think one thing I really like is that I'm not stuck behind a desk 24/7. 2 or 3 times a week, I'll go out to different hospitals, testing a number of pieces of equipment. So it really does help vary things up. Another thing I like is that it's really hands-on. You're going out testing lots of pieces of equipment and you're essentially performing like miniature physics experiments. So that suits me right down to the ground. So my job's pretty secure. It's actually labelled as a permanent role. So it's really nice to know that my long-term future is secure. So I think what motivates me is knowing that what I do in my job can affect the patient. If we find a fault with an X-ray machine and it's producing too much radiation, then the patient could be exposed to too much radiation, and that can lead to a higher chance of developing cancer. And also, we're checking image quality of these things, and if they're not up to scratch, then the radiographers, the doctors are going to be less able to effectively treat and diagnose patients. What else motivates me is just the fact that the NHS has been there on several occasions in my life, whether it's just been from playing football and breaking a bone, or for when my nan needed end-of-life care. So it feels really good to be using my skills gained from my PhD, my degree, to be helping an organisation that helps other people. And you get paid to do it too. So I think a key skill is solving problems. It might be something as simple as just being able to turn on the X-ray unit and work out how to use it. They are quite different from one another and they can be quite confusing. But it could also be a significant problem. There might be a fault and it's your responsibility to identify that and report it and make sure the right people are contacted to come out and fix the problem. So I mainly interact with other clinical technologists and clinical scientists. At the moment, as part of my training, I'll go out with one of them to a hospital, test a piece of equipment together. But I also interact with a wide range of people. It could be from secretaries to radiographers, doctors, engineers. So I'm not sure my route to the role is a typical one. I had experience in radiation protection from my PhD, and I applied based on that. But you could have experience from your degree. You could apply for apprenticeship and work your way up. But what I would suggest is just having a look on the NHS jobs website, seeing what's out there, seeing what's suitable for you, and apply for something. Because it really is a great place to work.